Everything you need to know about chronic kidney disease. Chronic kidney disease, CKD, means your kidneys are damaged and can't filter blood the way they should. The disease is called chronic because the damage to your kidneys happens slowly over a long period of time. This damage can cause wastes to build up in your body. CKD can also cause other health problems. The kidney's main job is to filter extra water and wastes out of your blood to make urine. To keep your body working properly, the kidneys balance the salts and minerals, such as calcium, phosphorus, sodium, and potassium, that circulate in the blood. Your kidneys also make hormones that help control blood pressure, make red blood cells, and keep your bones strong. Kidney disease often can get worse over time and may lead to kidney failure. If your kidneys fail, you will need dialysis or a kidney transplant to maintain your health. The sooner you know you have kidney disease, the sooner you can make changes to protect your kidneys. How common is CKD? CKD is common among adults in the United States. More than 37 million American adults may have CKD. Who is more likely to develop CKD? Research shows a link between kidney disease and heart disease. People with heart disease are at higher risk for kidney disease, and people with kidney disease are at higher risk for heart disease. Researchers are working to better understand the relationship between kidney disease and heart disease. Family history of kidney failure. If your mother, father, sister, or brother has kidney failure, you are at risk for CKD. Kidney disease tends to run in families. If you have kidney disease, encourage family members to get tested. Use tips from the Family Health Reunion Guide and speak with your family during special gatherings. Your chances of having kidney disease increase with age. The longer you have had diabetes, high blood pressure, or heart disease, the more likely that you will have kidney disease. African Americans, Hispanics, and American Indians tend to have a greater risk for CKD. The greater risk is due mostly to higher rates of diabetes and high blood pressure among these groups. Scientists are studying other possible reasons for this increased risk. What are the symptoms of CKD? Early CKD may not have any symptoms. You may wonder how you can have CKD and feel fine. Our kidneys have a greater capacity to do their job than is needed to keep us healthy. For example, you can donate one kidney and remain healthy. You can also have kidney damage without any symptoms because, despite the damage, your kidneys are still doing enough work to keep you feeling well. For many people, the only way to know if you have kidney disease is to get your kidneys checked with blood and urine tests. As kidney disease gets worse, a person may have swelling, called edema. Edema happens when the kidneys can't get rid of extra fluid and salt. Edema can occur in the legs, feet, or ankles, and less often in the hands or face. Symptoms of advanced CKD: chest pain, dry skin, itching or numbness, feeling tired, headaches, increased or decreased urination, loss of appetite, muscle cramps, nausea, shortness of breath, sleep problems, trouble concentrating, vomiting, weight loss. People with CKD can also develop anemia, bone disease, and malnutrition. Does CKD cause other health problems? Kidney disease can lead to other health problems, such as heart disease. If you have kidney disease, it increases your chances of having a stroke or heart attack. High blood pressure can be both a cause and a result of kidney disease. High blood pressure damages your kidneys, and damaged kidneys don't work as well to help control your blood pressure. If you have CKD, you also have a higher chance of having a sudden change in kidney function caused by illness, injury, or certain medicines. This is called acute kidney injury, AKI. How can CKD affect my day-to-day life? Many people are afraid to learn that they have kidney disease because they think that all kidney disease leads to dialysis. However, most people with kidney disease will not need dialysis. If you have kidney disease, you can continue to live a productive life, work, spend time with friends and family, stay physically active, and do other things you enjoy. You may need to change what you eat and add healthy habits to your daily routine to help you protect your kidneys. Will my kidneys get better? Kidney disease is often progressive, which means it gets worse over time. The damage to your kidneys causes scars and is permanent. You can take steps to protect your kidneys, such as managing your blood pressure and your blood glucose, if you have diabetes. Causes of chronic kidney disease. Diabetes and high blood pressure are the most common causes of chronic kidney disease, CKD. Your healthcare provider will look at your health history and may do tests to find out why you have kidney disease. The cause of your kidney disease may affect the type of treatment you receive. Diabetes. Too much glucose, also called sugar, in your blood damages your kidneys' filters. Over time, your kidneys can become so damaged that they no longer do a good job filtering wastes and extra fluid from your blood. Often, the first sign of kidney disease from diabetes is protein in your urine. When the filters are damaged, a protein called albumin, which you need to stay healthy, passes out of your blood and into your urine. A healthy kidney doesn't let albumin pass from the blood into the urine. Diabetic kidney disease is the medical term for kidney disease caused by diabetes. High blood pressure. High blood pressure can damage blood vessels in the kidneys so they don't work as well. If the blood vessels in your kidneys are damaged, your kidneys may not work as well to remove wastes and extra fluid from your body. Extra fluid in the blood vessels may then raise blood pressure even more, creating a dangerous cycle. Other causes of kidney disease. Other causes of kidney disease include a genetic disorder that causes many cysts to grow in the kidneys, polycystic kidney disease, PKD. An infection, a drug that is toxic to the kidneys. A disease that affects the entire body, such as diabetes or lupus. Lupus nephritis is the medical name for kidney disease caused by lupus. IgA glomerulonephritis. Disorders in which the body's immune system attacks its own cells and organs, such as anti-GBM, Goodpasture's disease. Heavy metal poisoning, such as lead poisoning. Rare genetic conditions, such as Alport syndrome. Hemolytic uremic syndrome in children. IgA vasculitis. Renal artery stenosis. How can I tell if I have kidney disease? Early kidney disease usually doesn't have any symptoms. Testing is the only way to know how well your kidneys are working. Get checked for kidney disease if you have diabetes, high blood pressure, heart disease, a family history of kidney failure. If you have diabetes, get checked every year. If you have high blood pressure, heart disease, or a family history of kidney failure, talk with your healthcare provider about how often you should get tested. The sooner you know you have kidney disease, the sooner you can get treatment to help protect your kidneys. What tests do doctors use to diagnose and monitor kidney disease? To check for kidney disease, healthcare providers use a blood test that checks how well your kidneys are filtering your blood, called GFR. GFR stands for glomerular filtration rate. A urine test to check for albumin. Albumin is a protein that can pass into the urine when the kidneys are damaged. If you have kidney disease, your healthcare provider will use the same two tests to help monitor your kidney disease and make sure your treatment plan is working. Blood test for GFR. Your healthcare provider will use a blood test to check your kidney function. The results of the test mean the following. A GFR of 60 or more is in the normal range. Ask your healthcare provider when your GFR should be checked again. A GFR of less than 60 may mean you have kidney disease. Talk with your healthcare provider about how to keep your kidney health at this level. A GFR of 5 or less is called kidney failure. Most people below this level need dialysis or a kidney transplant. Talk with your healthcare provider about your treatment options. You can't raise your GFR, but you can try to keep it from going lower. Creatinine. Creatinine is a waste product from the normal breakdown of muscles in your body. Your kidneys remove creatinine from your blood. Providers use the amount of creatinine in your blood to estimate your GFR. As kidney disease gets worse, the level of creatinine goes up. Urine test for albumin. If you are at risk for kidney disease, your provider may check your urine for albumin. Albumin is a protein found in your blood. A healthy kidney doesn't let albumin pass into the urine. A damaged kidney lets some albumin pass into the urine. The less albumin in your urine, the better. Having albumin in the urine is called albuminuria. A healthcare provider can check for albumin in your urine in two ways. Dipstick test for albumin. A provider uses a urine sample to look for albumin in your urine. You collect the urine sample in a container in a healthcare provider's office or lab. For the test, a provider places a strip of chemically treated paper, called a dipstick, into the urine. The dipstick changes color if albumin is present in the urine. Urine albumin to creatinine ratio, UACR. This test measures and compares the amount of albumin with the amount of creatinine in your urine sample. Providers use your UACR to estimate how much albumin would pass into your urine over 24 hours. A urine albumin result of 30 mg per gram or less is normal. More than 30 mg per gram may be a sign of kidney disease. If you have albumin in your urine, your provider may want you to repeat the urine test 1 or 2 more times to confirm the results. Talk with your provider about what your specific numbers mean for you. If you have kidney disease, measuring the albumin in your urine helps your provider know which treatment is best for you. A urine albumin level that stays the same or goes down may mean that treatments are working. How do I know if my kidney disease is getting worse? You can keep track of your test results over time. You can tell that your treatments are working if your GFR stays the same. Urine albumin stays the same or goes down. Your healthcare provider will work with you to manage your kidney disease. Managing chronic kidney disease. If you have chronic kidney disease, CKD, you can take steps to protect your kidneys from more damage. The sooner you know you have kidney disease, the better. The steps you take to protect your kidneys from damage also may help prevent heart disease and improve your health overall. Making these changes when you have no symptoms may be hard, but it's worthwhile. 10 ways to manage kidney disease. 1. Control your blood pressure. 2. Meet your blood glucose goal if you have diabetes. 3. Work with your healthcare team to monitor your kidney health. 4. Take medicines as prescribed. 5. Work with a dietitian to develop a meal plan. 6. Make physical activity part of your routine. 7. Aim for a healthy weight. 8. Get enough sleep. 9. Stop smoking. 10. Find healthy ways to cope with stress and depression. Control your blood pressure. The most important step you can take to treat kidney disease is to control your blood pressure. High blood pressure can damage your kidneys. You can protect your kidneys by keeping your blood pressure at or less than the goal set by your healthcare provider. For most people, the blood pressure goal is less than 40/90ths of a millimeter Hg. Work with your healthcare provider to develop a plan to meet your blood pressure goals. Steps you can take to meet your blood pressure goals may include eating heart-healthy and low-sodium meals, quitting smoking, being active, getting enough sleep, and taking your medicines as prescribed. Meet your blood glucose goal if you have diabetes. To reach your blood glucose goal, check your blood glucose level regularly. Use the results to guide decisions about food, physical activity, and medicines. Ask your healthcare provider how often you should check your blood glucose level. Your healthcare provider will also test your AC. The AC is a blood test that measures your average blood glucose level over the past 3 months. This test is different from the blood glucose checks you do regularly. The higher your AC number, the higher your blood glucose levels have been during the past 3 months. Stay close to your daily blood glucose numbers to help you meet your AC goal. The AC goal for many people with diabetes is below 7%. Ask your healthcare provider what your goal should be. Reaching your goal numbers will help you protect your kidneys. Work with your healthcare team to monitor your kidney health. The tests that healthcare providers use to test for kidney disease can also be used to track changes to kidney function and damage. Kidney disease tends to get worse over time. Each time you get checked, ask your provider how the test results compare to the last results. Your goals will be to keep your GFR the same, keep your urine albumin the same or lower. Your healthcare provider will also check your blood pressure and, if you have diabetes, your AC level, to make sure you are meeting your blood pressure and blood glucose goals. Know that your medicines may change over time. Your healthcare provider may change your medicines as your kidney disease gets worse. Your kidneys don't filter as well as they did in the past, and this can cause an unsafe buildup of medicines in your blood. Some medicines can also harm your kidneys. As a result, your provider may tell you to take a medicine less often or take a smaller dose. Stop taking a medicine or switch to a different one. Your pharmacist and healthcare provider need to know about all the medicines you take, including OTC medicines, vitamins, and supplements. Be careful about the over-the-counter medicines you take. If you take OTC or prescription medicines for headaches, pain, fever, or colds, you may be taking nonsteroidal anti-inflammatory drugs, NSAIDs. NSAIDs include commonly used pain relievers and cold medicines that can damage your kidneys and lead to acute kidney injury, especially in those with kidney disease, diabetes, and high blood pressure. What if my kidneys fail? Some people live with kidney disease for years and are able to maintain kidney function. Others progress quickly to kidney failure. Kidney failure means that your kidneys have lost most of their ability to function, less than 15% of normal kidney function. If your kidney function drops to this level, you may have symptoms from the buildup of waste products and extra water in your body. To replace your lost kidney function, you may have one of three treatment options: hemodialysis, peritoneal dialysis, kidney transplant. End-stage renal disease, ESRD, is kidney failure that is treated by dialysis or kidney transplant. Some people with kidney failure choose not to have dialysis or a transplant but continue to receive care from their healthcare team, take medicines, and monitor their diet and lifestyle choices. Work with your healthcare team and family to consider your options and choose a treatment that is right for you.